Namaskar, hello, and welcome to this special episode of the IndiGlobal Edge Factor that brings to you scientific, well researched insights from healthcare leaders, policymakers, innovators, and experts from across the globe, empowering transformation. The ongoing COVID 19 era, the first wave, has made us realize and it reminded us that the entire world is nothing but one global village. Following that, the second wave had us all shaken up given its fatality and death rates. Now, the prevailing scenario that is considered and widely believed as the third wave caused by yet another variant of coronavirus Omicron. In today's exclusive live panel discussion, we would be focusing on the Omicron impact and the new way of life living with the corona variants. This special live episode is brought to you by IndiGlobal Media Network that takes innovation, collaboration, and growth to the forefront. My name is Sudhir Gautam. I'm the founder, CEO, and editor in chief with IndiGlobal Media Network. And I am joined by my colleague, Kaniza Garari. You're on mute, Kaniza.
The third wave with Omicron variant has got people worried. Everyone is very anxious as to how the third wave will pan out. What are the implications? We bring to you a panel of experts who will dwell on this panic scenario and who will give us a clear picture of how life will be living with the COVID 19 variants.
And I'm sure today's panel discussion is going to be vibrant with leaders who are joining us from across the country. And today's first speaker, it's an honor to have these speakers. And today's first speaker, let me tell you, he is a well known gastroenterologist in India. He is the past president of World of Endoscopy Organization and a pioneer in gastroenterology treatments in India. He has carried out extensive research on COVID 19 in Asian Institute of Gastroenterology. A special team was created to deal with COVID 19 patients, and research was conducted to understand the impact of treatment. A comprehensive guide for treating COVID 19 patients has been published under guidance of the speaker. Please join me in welcoming none other than Dr. D. Nageshwar Reddy, Chairman for Asian Institute of Gastroenterology.
Thank
Thank
you.
you very much, Dr. Nageshwar. Next up, we would like to call upon yet another healthcare leader in the Indian healthcare system. As He worked as a professor in surgery in Tirunelveli Government Medical College, passionate about the concept of family medicine. Pandemic took the lives of close to 1492 doctors, according to official records of Indian Medical Association. That is encouraging young doctors to actively be part of organization protection of doctors and their family, which is of utmost importance. So please join me in welcoming Professor Dr. J.A. Jayalal. He is the National President of Indian Medical Association, New Delhi.
Thank you.
Pleasure having you, Dr. Jayalal. Next up, I would like to call upon yet another leader in the scientific and healthcare sector. He has been the former director for Center for Cellular and Molecular Biology, which is in Hyderabad, CCMB Hyderabad. CCMB played a key role in genomic surveillances of SARS-CoV-2 during the COVID-19 pandemic. Research conducted under his guidance has predicted that Delta variant in December 2020. Now he is currently heading a well-reputed organization, Tata Institute for Genetics and Society, Bangalore. Please join me in welcoming Dr. Rakesh Mishra, Director, Tata Institute for Genetics and Society. So now I would request my colleague Kaniza to call upon the rest of the speakers.
Yes. We also have with us Mr. Gaurav Khanna, CEO of Glendale Hospitals, who will be dwelling on the way hospitals have managed the first, second, and third wave. Please welcome Mr. Gaurav Khanna.
So I would request my Kaniza to also call upon the next speaker. Maybe there is some technical hitch.
Okay, we also have with us Dr. Gayatri Kamineni, Chief Operating Officer of Kamineni Hospitals. She will be talking to us about the manner in which vaccination has taken place in the country and the way forward with children. Ambulances made a very important part of taking patients to the hospitals. And we have a young innovator, Pranav Bajaj, with us, who will be talking to us about how ambulances played a key role and what were the challenges that they faced at the ground level.
While our speakers would be coming on screen, we would also be joined by a special guest. We would be announcing him at the end of this session. Meanwhile, without further ado, we would like to call upon our first speaker, whose team has done extensive research in the COVID 19 pandemic. And we would like to call upon our first speaker Dr. D. Nageshwar Reddy. Sir, we would like to have your initial remarks on this.
Yeah, thank you, Sudhir and Kanija. This is, I think, a very important webinar in the sense that we are now actually in the peak or midst of the third wave, which is rapidly replaced the other waves. And I think this is, for the researchers, an exciting period, but for the country and for the patients, it's not. I think we have to overcome this. And my belief is that the way it's going, almost everyone seems to be getting infected. We just learned today that the infectivity rate in Kerala was 1 in 40. That is 40% was the positivity rate when they tested, which means half of the population there was being positive when they tested. And soon I think it's going to take over completely. This is the bad news. The good news is, of course, Omicron is very mild. The clinical symptoms are not serious enough for patient to get hospitalized ICU, and it's giving protection against other forms of therapy. Of course, we'll go into little detail into that subsequently. So this is the good news part of it. So I think we are looking forward to some exciting discussions during this webinar. Thank you.
Yes, sir. Sir, how do you think that this is affecting the post-COVID patients? Because those who suffered from post-COVID symptoms, how is Omicron coming out in them, sir?
This is a very important question, Kanija, that there's been a recent study which came from University of Washington, and again, two other studies which duplicated this, all in preprint. And what they found was very interesting. They found that if somebody has Omicron, did not have previous infection at all, no vaccination, the amount of protection that is produced because of Omicron was, say, 20%, not so much. That is, they can get reinfected again. But if somebody had a previous Delta infection and had Omicron, then these people had not only a milder infection, but were also protected against future variants of Omicron, Delta, and so on. And finally, if somebody had a previous infection, had vaccination, including a booster dose, then the amount of protection was tremendous. They were completely protected against previous infection and protected against future infections of all variants. So this now actually calls for a multivariant vaccine, which contains components of Omicron, Delta, and so on. So in short, the answer to this is that if somebody had a previous COVID and developed Omicron, the infection is usually mild, it is not producing any long COVID, and they're going to be protected against future variants of this virus.
Okay. So, since we also have this genome sequencing where we found that a large number of people who were affected in India were from the Delta variant, my question is to Dr. Rakesh Mishra. Sir, now what is the status of genome sequencing as far as India is concerned, as far as all the states are doing? Are there enough samples coming in? And what is the way forward?
Unmute. You know.
Can you please unmute, sir? Yeah.
Yeah.
Yeah, sorry. So, thank you for asking this question. As you mentioned, genome sequencing has been a major tool in following up this and managing this pandemic, unprecedented way. I mean, millions and millions of sequences have been deposited and shared in public domain, so we can take advantage of the information and fine tune our strategy. The reason sequencing is important because the biggest strength this virus has is that it keeps mutating and newer versions keep appearing, which, and when they become very prominent, increase their footprint, we start calling them variants of concern or interest. And India has been doing well. We have maybe we haven't sequenced a huge number like the UK or US, but so far, with little bit of luck, we have not missed out much because Delta was picked quite early that there is a new variant, and which was then called double variant, double mutant, and those kind of things. But it was picked quite early, and also we should not expect that genome sequencing will prevent any variant from emerging, because you will know about the variant only when through sequencing when it has spread. Otherwise, it will not be even known that there is a variant prevailing. So we have been doing well, and even Omicron has entered in India. It was picked in Bangalore first, and then through travelers, and now we know more or less sure that there is a community spread, and very large number of people are getting infected by this, as Dr. Nageswar Reddy just mentioned. The important thing of the following the by the sequencing is that if we start to see sudden increase in some pockets, or if we see symptoms are different, or if we see mortality changes, we should immediately go and look whether there is a new variant emerging from there, or it is because of comorbidity or misbehavior or indisciplined behavior of people that sudden explosion of cases has happened. So the genomic sequencing comes in handy and gives us the precise information, and so that we can modify our strategy. If it was crowd behavior, we know that it's not a new variant, it's crowd. But if it was not a crowd and we pick new variant, that means there is something to put now stricter measures because this is spreading. And now also, please remember that Delta is still around. So when we are seeing that people who are infected with Delta compared to people who are infected with Omicron have different clinical symptoms. So and Omicron, as you just heard, that hugely transmissible. So our strategies have to be different. Now testing, tracking, and isolating is important, but priority has to be how we manage the hospitals and how we see that people are vaccinated and slow down the infection, rather than doing 100% tracking and testing, which could be a better strategy at certain point. Although we hear many things about the variants and pandemic, but I would like to emphasize that India today is in one of the strongest position as far as pandemic is concerned. We have 70-80% seropositivity even before this new wave began, and we have a remarkable vaccination success so far. Close, I mean, over 90% eligible people having vaccine. Now children are getting vaccinated. And so this seropositivity between prior exposure and the vaccination, I just heard from Dr. Nageswar Reddy, is really coming very handy and is protecting people. Milder symptoms are not only because Omicron is kind. Milder symptoms are because we are protected now with the prior infections. Now I can say thanks to second wave, and of course the fantastic job done by of the vaccination. So with these two things, if we keep following and surveying properly, to see that if there is new lineage, new variant emerging, and take appropriate care. I think there is no need to panic. Numbers will be very high, but it will not have much impact if we contribute little bit in cooperating with vaccination and avoiding clustering.
Okay. My next question would be to Dr. Jayalal. Sir, where is the challenge in terms of vaccination, and where do you think vaccine hesitancy needs to be tackled? What is it that we must first do?
Yeah, thank you. But fortunately, in India, the vaccine hesitancy is much lesser than even some of the Western countries what we are facing. When it was started in January 2021, and there were a lot of hesitancy were there. But Indian Medical Association and most of the higher end doctors of the priority on the frontline doctors, they came forward and took the vaccine from the front line. So they were able to expose and tell the public that vaccination is going to be safer and it is going to be protective. Because of that, that altruistic efforts by the many of the frontline healthcare workers and the doctors across the country, and working with the root level, now vaccine hesitancy is definitely less. Even in our age, we are getting now 92% of the people have taken the first dose vaccine, and nearly 72% people have taken the second dose. That means the vaccine hesitancy is less. But we had some problem in accessibility to the areas which are far reaching consequences, tribal areas, or the areas where the people's reachability was less. And again, thanks to the government of India and the committed work of the healthcare workers, and we have able to reach out to them, and various separate and exclusive teams were constituted to reach the people in the remote areas. Today, fortunately, we are reaching that all the adult population, many of them are reached. And now in the second set of the vaccinating for the pediatric age group also, definitely we are in a very better position we are reaching. And today we are in much more, our armamentarium has enhanced. Not only that, it's a Covaxin and Covishield and plethora of vaccines are available. And soon I think the vaccines will be available in the open market also. So we will be doing a dramatically better position than any of the Western countries in the vaccination drive. This is one of the great success of Indian government and the Indian healthcare system, where amidst all the difficulties and all some of the people even trying to push in their idiosyncratic ideas against the vaccination, modern medical professionals are able to stand firm and establish in this country the vaccination is one of the greatest tool for us to combat this disease. Today, if you are in the comfortable position in the third wave and knowing very well that we are able to face the challenges in a better way, I think the credit goes to the vaccination. I must salute all those people who has contributed for the success in identification, invention, and also the manufacturing of this vaccine to the people. Only our appeal to the government is we should make it is research and the indigenous method should be see that how we are going to change our vaccine component or vaccine composition depending upon the mutations which are happening in the virus, because it's an RNA virus, mutations are bound to happen and it is going to be there for some more time. So we need to definitely put more efforts on research and the identification or changing the vaccination component so that we will be able to be in a very comfortable position to the face of it. So I'm very comfortable, happy and very optimistic on the vaccination drive which India has done so far.
Okay. So does this mean that the multi-strain vaccine that Dr. Reddy has just mentioned will be the way out, or will we have a new vaccine every year which will come?
No, it
To
is
Dr.
the
Jayalal. Yes.
multi-strain vaccine only, because may not be a totally a new vaccine. See, now we have a pneumococcal vaccine which we are giving. Every time there will be the strains will change. Similarly, the influenza vaccine, there will be strains will be changing. So we need to be consciously on that. Second change we need to make on the route of administration. Any vaccine, when it is given as a injection, it has its own hesitancy. Some amount of hesitancy will be there. But if we are now we are in the process of getting the nasal vaccination, that is a spray vaccination which we are coming. So when we are having that advantage of the route of delivery is also changed, I think we will be in a very formidably comfortable position.
Okay. Okay, sir.
Yeah.
So now we also wanted to understand what is the difference between the first, second, and third wave as far as emergency calls are concerned. This is my question to Pranav. And if you could just tell us what is the situation at the ground level?
Can you please unmute, Pranav?
Mute.
I'm so sorry. I would say that
Yeah.
the three waves are completely different, right? When the first wave happened, it was very sudden and ended up hitting us when human lives are being disrupted in ways that were unimaginable at that time. I would say there was a lot of very less information on how the virus is spreading from an emergency response point of view. There was very little know-how on sanitization processes, fumigation processes, even something as simple as COVID-19 protocols for patient handling. I would say a partnership with the government in Delhi really helped us to become more aware about in terms of the protocols that were needed during the first wave of the pandemic. The second wave of the pandemic, I would say, was something where cases went up very rapidly, right? Where all of us saw huge lives being lost. I think the main reason for that was we saw a lot of challenges, especially availability of oxygen, not only oxygen cylinders, oxygen concentrators inside the ambulances acted as a challenge. So I would say there was not a lack of availability of ambulances during that time, but also resources that ultimately have did have that impact. Also, something that happened was the admission times in the hospitals went up during the same time period. Usually, on an average, we could see an average admission time of up to an hour in the hospital, which went up to about 3 to 5 to 6 hours at that time, right? So, a lot of people were spending time inside the ambulances, reliant on the resources inside the ambulance itself, which further led to people thinking that there was scarcity in the emergency response industry during that time period. We serviced about 1,000 calls on a daily basis during the second wave of the pandemic. About 70% were COVID patients, 30% were general emergencies, which was about a 60% increment on a day-to-day basis, right, which we saw. Um, Compared to the third wave right now, I would say, wherein we did see an increment in cases again. However, data suggests that serious cases, percentage of deaths or hospitalization is much lower. I would say that we could um, also give credit to the rampant penetration of vaccinations across the country to this happening. I think we are more prepared also now in terms of data as to bed availability in different hospitals, government as well as both private, which was also not present during the second wave of the pandemic. Another trend that we've seen during the third wave is we've seen a massive increase in people reaching out to doctors. I'm talking about a doctor on call module when people are actually, instead of going to the hospital, the cases are much less severe. They're very happy to speak to a doctor, talk about their symptoms, and I think are getting treated more at home compared to the second wave this time.
Okay. And in the emergency calls, do you see any non-COVID cases also a rise in number, or is it only the COVID calls that you're getting? Because what about the
No,
non-COVID
absolutely.
calls?
We are an organization that came in to cater to any kind of emergencies. COVID-19
Yes.
came in, I would say, only in 2020, right? But of course, since the
No, no.
last year,
Yeah.
I would say about in the second wave, we were doing about 70% COVID cases, is what I would say, which has come down to about 40% today, right? And about 60% would be general emergencies. However, when a wave happens, we have to treat every case like a COVID case, right? So irrespective whether it is a COVID positive or a suspect patient, we have to maintain the same protocols. So for us, every patient has to be treated as a COVID suspect patient for every emergency.
Absolutely. So my next question would be to Mr. Khurana. After facing the wave one and wave two, and also the vaccination, there is a sense that we are in a better position to deal with the third wave. Still, we would like to know from you, Mr. Khurana, that are there any challenges at the outpatient and also in regards to the teleconsultations?
See, healthcare anyways was very well equipped for telemedicines initially since 1990s, and the only thing that has happened now that we had to go into the tier 2 cities and tier 3 cities also. So in metros it was not an urgency, and in any of the corporate hospitals it was very well equipped. So we just had to give the information to the public that we are ready, and they can have a consult with us, and that should not have an issue. So connectivity was not an issue. Everybody has a smartphone now, so they're well equipped to understand how exactly it is done. So some of the near done people also, they might be residing in some other country, so they wanted to know what is happening with their patients. So we had a video consult with them also. The psychological support, the quarantine people, they could have viewed anytime, anyways. The doctor was available, so that connectivity and that psychological support was quite a lot. So we've evolved from what we were as a telemedicine, and then evolved as that video consults could happen. So I don't think so there were challenges with corporate hospitals, but for the nursing homes and tier 1 and tier 2 cities majorly, we surely had some issues initially with the first COVID wave. Thereafter, it has been a routine now. It's a normal thing.
Okay. And
So,
sir, do you also get Dr. Khurana, do you also have this eICU system where you find that the patients are being taken care of in the long run?
Yes, we do, and surely other hospitals also have been equipped now. So now, what is happening? Patients are comfortable, but their relatives surely have that inhibition that what is happening with my patient. So we surely have it not only for healthcare workers; they can monitor the patient at any time at their home. Also, the doctors can monitor them, and similarly, the patients also, the attendants can talk to them over phone. They can have a video call, they can have a video consult with them, so that that psychological support is also there for the patient, and the recovery becomes better. So once they talk to their near ones, so it becomes more easy. So everybody will not have some relatives residing nearby, so they might have somebody who's across any other part of the country, or maybe any other country also. So that connectivity surely gives us an advantage when we're talking about video consults. And ICUs, we are very well equipped now.
Yeah, Dr. Khurana, could you also tell us, like, did you observe any kind of trend in the recent times? There is also like non-COVID cases. Usually, people are suffering with the symptoms of fever, cold, and throat uh, infection and all. So, there might be people are have been looking at it as a COVID-19 Omicron infection. What is that? How did you guys all deal with this kind of confusion among the citizens?
It's more of knowledge sharing. When they talk to a doctor, it clearly demarcates whether it requires a hospitalization, whether they would like to go for some test, it is a common cold, or it is going towards something which has a symptom of COVID. So that way, the connectivity over phone, over video call has gone up, and we surely get some consults getting onto that. So people have been aware. So people where they have lost somebody in the first or the second wave, they're more conscious, they're more approachable, they want to know more. So they want to educate themselves, and they don't want to miss or lose anybody at this time again. So that is where they have the concern. So more of communication, so the more of reach with the people is more important at this time, rather than just doing a Google search and just contemplating anything that they think. So it's better to consult rather than just having without any knowledge, just doing a Google, and that should not be the issue. So consultations are applicable. So anywhere they can talk to a doctor. So any of the hospitals is equipped. So they can always talk to their physician. They should surely talk to a physician rather than doing anything on a self medication.
Absolutely. So my next question would be to Dr. Gayatri Kamineni. Ever since there was a dip in the second wave, and there was also a prediction that the third wave would come up, and that will actually infect the children more. We would like to know from you, Dr. Kamineni, like what is the impact of the wave three on the children, and could you also tell us about the trend of vaccination among the children?
So, I've seen that children have been significantly impacted by ongoing pandemic, obviously. To elaborate the impact, I think we can divide it into physical and psychological. Physical, which includes nutrition, growth, home environment, and psychological, which includes social, behavioral, mental health, etc. To be very clear, children are not actually the most affected by COVID-19. Their symptoms have been mild. Nevertheless, they don't stand equal footing when it comes to coping with economic and social effects. COVID has us to face it, right? The policies of confinement and social distancing have an effect on every part of the child's world. COVID directly affected childcare arrangements, education, and leisure like play and exploring outside. Nutrition being provided at schools has been limited, almost next to nil, and most of the groups that have been affected are below poverty. So we need to very clearly keep in mind that below poverty line children coming from poor families and also lower middle class income families who are actually dependent on their jobs, who do manual labor, they are also highly dependent on the income that they earn. When they have lost their work, that is when the child has also been affected. The children affected by COVID is actually not the clinical aspect of it that we need to concentrate on. It's actually on the non-clinical aspect of it. We are very used to the concept of sending children to school. They are also used to it. But now that they have lost that, it's almost been 2 years that children have actually gone to school continuously. So it has actually affected children. There have been behavioral changes. They don't know how to conduct themselves in front of their own peers. They can't tell their problems. They can't see how they are supposed. They don't know how to behave. They don't know how to be a child. They've always been around adults. They've always been wearing masks. So this has become the norm for them. So digital schooling actually has been a big boon for children who can use or who have the facility to use technology. But children who are coming from poorer families, from below poverty line families, they do not have that. They cannot go, they cannot get a tab, they cannot go and get a system. They don't have the exposure to internet per se, but expecting them to actually go ahead and do online classes is almost next to impossible. So these are the things that have actually affected. The more important thing that actually has affected children during the pandemic is the exposure to violence at home. The domestic violence cases have increased dramatically during the COVID pandemic, during the lockdown. Many reports have suggested that. So, the exposure of children to domestic violence, whether it is there within their family or within their surrounding, is something that we need to really, really look at. There need to be helplines for children, or there need to be therapists who are ready to talk to them. But again, if you're going to digitize that, that one-to-one, that human connection might actually be, it's quite difficult to manage that. So mental health of adults at home is very important for the mental health of the child to actually be stable.
Yeah,
Yeah.
that's the perspective of the whole COVID, which has been brought out very well, Dr. Kamineni. Because while we are talking about the first, second, and third wave, this is one aspect which needs to be really looked into. And I'm sure all the healthcare people are here, and there will be something that will be worked out in terms of that. Uh, our next round of questioning begins, and my next round is to Dr. Nageshwar Reddy. Sir, we wanted to understand how, in the third wave, what are the severe cases that are being seen at the hospital level, and how are we going to come out of it in terms of what is the way forward for all of us?
So again, thank you, Kanija, for this question. I think what we are like, what was emphasized by both Dr. Rakesh Mishra and Dr. Jailal, the third wave symptomatology has been extremely mild. For example, to give an example, in the second wave, hospital, we used to have about approximately 300 to 400 patients admitted constantly. Around 60 to 70 patients used to be in the intensive care unit. In this particular wave, of course, due to awareness and so on, the number of patients who are hospitalized are less than 100, and also the number of intensive care patients are extremely low. Right now, we have only 20 patients, and some of them could be Delta also, but predominantly both hospitalization and intensive care need has decreased in the third wave. majority are mild. And again, to emphasize what Dr. Rakesh and Dr. Jailal have said, that it's, I think, our vaccination drive and the previous infections that have occurred in our population, the immunity that has saved us from this. So going forward, what do we do? I think going forward, it's very important that we look at continuing this vaccination program on an annual basis, either in a form of multivalent vaccines, which can, of course, change based upon the need for. That's the reason why I think genomic sequencing becomes very important. And I think the services that Dr. Rakesh Mishra has done from CCMB can be complemented on. In fact, they've established genomic sequences which are frequently can now be done so that you know which variant is coming and which variant is going to be predominant. And based on that, we can actually tell our vaccine manufacturers. I think Indian vaccine industry is very strong. So this can be told before, kindly prepare this so that we are prepared for this. So my look at this is very optimistic. I think we are past the major danger part. We are going to have a rapid downfall of this present third wave by end of maybe February, and March should be better new year for us. And hopefully, even if future infections come, they would be more in form of very mild infections. And I think, like again, what Dr. Gayatri mentioned, there's a huge psychological component both for children and adults. We would have overcome that once we realize that these infections are mild. And already, I think Britain has showed us the way that you have to think aggressively, go forward, and we should not be cowed down by this infection.
Okay. That's I think the way forward. And thank you, doctor. That will, I'm sure a lot of listeners who are panicking at home will find this as a big comfort for everyone. My next question is to Dr. Rakesh Mishra. Sir, what should now be the policy in terms of genome sequencing? And how should this be taken up on a regular basis so that we know which is the mutant which will now be there over the next few years?
Thank you. Yeah. So as you know now that this is spread is very fast, large number of people are going to be covered. There's no point in sequencing the same kinds of infection again and again and again without much of an outcome. As we know that UK and USA have sequenced maximum number, hundreds of times more than what we have done. But that has not changed the disease scenario. You have to use the genome sequencing information in a appropriate way to make best use of it. So that's why your question is very relevant, that what strategy we should use for the future genome surveillance. So we need to understand why this virus mutates. What is the purpose of that? And as I mentioned earlier, this is the biggest strength of this virus, that because of the sheer number, it can afford lots of mutations. Large number of them will be of no use to the virus, and therefore they will never be spreading. But new variants will emerge with two main criteria. First is higher infectivity. Then only it will able to, like Omicron can replace Delta because it is more infectious than Delta. So a new variant is going to be more infectious, and then only it will be seen. Otherwise, it will always be Omicron. Second pressure, that is, although it is our advantage, the early infection and vaccine, this is also a challenge to the virus. Now virus will try to break this, break the vaccine protection, escape immune systems protections that have been acquired by any means of earlier expansion or vaccine. And so these are the two things one has to watch out for. To look for such variants which will now emerge from this, we have to take two kinds of approaches. One is do general randomized sequencing of low level from across the country, because variants can emerge anywhere. It will not emerge only from Bangalore and Delhi and Hyderabad. It will emerge from smaller cities, towns. So good to know early on, and whenever we see some new variant emerging and every week it is increasing, we can only restrict that part and prevent it from going anywhere else. No matter what variant it is, it can go only if we allow it to go. If we are wearing the mask and not crowding, many variants would have not seen the light of the day because we didn't let them go beyond. So that is very important. One thing we have to see, that mask has to be part of our culture, and that is one strong way of preventing the virus from spreading. The second thing will be to keep samples in sequence, more and more samples from the hospitals with the metadata of the patients where somebody is suffering. I would say that all ICU patient samples should be sequenced, so that's not a large number now. Also, as you just heard from Dr. Nageshwar Reddy, so that will tell us that whether there's yet another lineage or variant that is causing this problem, or it is the patient-specific issue of comorbidity. So there we will pick up early on if something of that kind is happening. So if we do that, and then as I said, if there is a sudden increase in some place, we should quickly sample that and see if this new variant or is some behavioral aspect, some rally or some marriage function or some such thing has done. So now our capacity is quite large for sequencing across the country. We are only using government setup at the moment. There are private facilities for sequencing available. Whenever time or need comes, they can be used. So we do not have really problem of capacity to sequence. And now there are lots of pipeline for analysis that are in place in many places, so data can be analyzed easily, and data is shared so others can also make use and strategize their plans for the future. And these are the things that are then giving feedback to how the pandemic is going, how the spread is happening, which kind of vaccine is required, and which kind of variant is more troublesome, more infectious, and those kinds of things. So we can accordingly strategize and make more, use more granular data to make more effective a localized strategy. We are a large country. We are not going to be one peak and one. We will have multiple peaks. Maybe some big cities peak is now already on the decline.
Yes.
Some places going up and down. So we should try to sample randomized way and also in targeted way using the clinical input or any epidemiological unusual feature that we see, and then use that information to conclude whether it's a new variant or same variant and so on, and make strategies to effectively reduce the damage. So as I said, we are in a strong position, but that doesn't mean that we should relax. I just want to end this uh, part of my discussion by just saying that please don't think that Omicron is a boon and it is a general vaccination thing. It is not a vaccine. It is a living virus. It is very infectious and it is mutating. So we should go for vaccine, not wait for a natural infection to come and vaccinate us. If vaccine was not there, I would have talked differently. Since vaccine is there in plenty, multiple types of this. So we should use that and not let the virus play with us and try out every mutant, every variant that is possible. We are lucky that it is our earlier infection and vaccines are protecting from the Omicron, but at the same time, we should not take it lightly. So go for vaccine as much as possible, as early as possible. We should go for a precautionary dose or booster dose as and when we can afford at a population scale. That is very, very important. And with all this in place, mask is the best vaccine that we have. We should always use that and never take the virus lightly. If we do that and avoid unnecessary crowding, I think we will be out of this and come to normalcy soon. And just that you just heard that what are the effects of this pandemic. Many of things Dr. Gayatri just mentioned a few. Those are the amazing, touching thing. It's very difficult to even imagine by many of us that what our children have gone through and how they will recover from this. We have to make a big plan for those things. So fight against this pandemic will continue beyond even the end of this pandemic because of obvious thing and economic and those other things. But I think we are in the correct position to, if we play our options wisely and behave in disciplined way, we are now seeing the end of the tunnel.
Sure. Thank you. Thank you very much, sir. And thank you for this message. This is very important for the viewers who are listening to us because there have been too many doubts, and this is very important. Thank you, sir. Thank you. My next question would be to Dr. Jayalal. Sir, how is the healthcare system now looking forward? While there are some states which are still to see the peak, and there are some cities which are already peaking, how are the doctors and the healthcare system going to take look at it in the future?
Yeah, definitely that we are optimistic. The medical fraternity is definitely optimistic at this moment, as both Dr. Rageshwar sir and the said that we are able to see a tunnel at the end of the tunnel. We are able to see. One thing we are also happy that this also re-emphasize the need of the healthcare infrastructure and priority for the healthcare which the government has to give has been well established in the post-COVID time. All the administrators, people who are in the power, has now understood the importance of the health as one of the very pillar of restoring the country in a very positive way. We also want to re-emphasize that the health of the country depends upon the health of the profession also. So health of the professionals has to be also taken care when the country wants to be become really healthy. If you see this COVID, there are so much of doctors are exposed to the disease. There are so much of death. More than 2,000 doctors have sacrificed their life, and still there is many times we are getting into the problem of manpower shortage, which is existing in the country. Government should realize and government should work hard as this COVID, though it is going to be in end very soon. But these such kind of pandemics are bound to happen. Such kind of pandemics will remain. So we need to put a lot of efforts to see to that the healthcare professionals and the manpower augmentation has to be done on a priority wise. And especially we are in that era that we are anticipating a budget. Normally, the healthcare budget which is allocated will be less than 1.5 percentage of the GDP for the health, and many other issue has a lot of will have a lot, but the healthcare budget will be very less. But after this COVID, with the COVID post-COVID syndromes and long COVID which are going to get in the way, we need and we are emphasizing and requesting the government for the healthcare allotment at least to 4 to 5% of the GDP has to be allotted for the healthcare for the people, because we are now seeing at least 20% of the people who have infected with the COVID coming with the symptoms of the post-COVID or the long COVID symptoms. So this is going to be a great disability, and still we are not sure what kind of impact this virus will produce on our immunity. Whether it is going to produce an autoimmunity more, whether it is going to have the lymphocyte the problems with our immunity system in the way of malignancy induction. So much of issues are there. So for all those things, the funding is also important. So the budget is one of the area where we are thinking that there will be more budget. And also the most importantly, what we are now looking for is an administrative pattern has to change. Now, if you see that in India, what we are seeing in an administrative sector or the India IAS or IPS cadres that they are taking care of the health. But health is a specialty subject that anyone cannot handle that. And we need a specialized people who, as we are now proposing the government as an Indian medical service, like Indian administrative service, a separate category of administrators who has the basic knowledge of the medicine by the virtue of their undergraduate degree in the medicine, and they should have the equal training like administrative training, and the people should come forward with an IMS. And if we have the people on the front line who is able to take care of the challenges of this healthcare by understanding the intricacy of the health system and the implementation, then that is the now need of the hour. We have seen there are areas where IAS, MBBS doctors who have the degree of IAS or IPS who are placing as a collectors or the people who are taking care of this COVID management. All those areas, the care was much more than the people who do not have the basic knowledge of the medicine are taking care. So it is not belittling anybody. It is only to say that if you want to have a comprehensive healthcare development, see in the forthcoming the how it is variants are coming, how the things are there, how things are evolving, and we need to have an administrator, somebody who work in the front line and take care of things, and they should be able to come in a much better way. So that we are focusing on that. And finally, or as a medical professional, we would also like to have the concept of research and development has to be there, and we cannot depend upon the Western countries for doing the research, and it is the Indian government and the ICMR should come forward to do much more research. And we are not very categorically we are expecting a lot from ICMR, because that is one forum where we need to do a lot of research on this again, and that also come with a little more transparency and little more involvement of the all the sector of the people has to be involved, and it cannot be from the top level down. It is a bottom up approach has to be followed, and then it will be there. But I am happy that medical professionals and the healthcare professionals, and I am saluting them for the courage with which they have stood forward, the altruism with which they have served, and they were able to safeguard the millions of people from the onslaught of this corona. Even in the Western countries, we are not able to get the mortality less than 1.5 percentage, and that was a great work done by the healthcare professional. And if the government is also supporting, and if everybody is working together, definitely we will be able to have a positive healthcare, because COVID has also taught the public on the preventive healthcare, the masking, the hand hygiene, and taking the respiratory hygiene, and avoiding crowding. So all these the good components of the preventive healthcare has been already incorporated or imbibed into the minds of the people. With the proactive people following the preventive protocol, and dedicated medical fraternity working forward, and administration coming together, I'm seeing a very positive healthcare system for our country, and I'm optimistic, and I'm sure and thank all of you, the stakeholders in the healthcare system, for coming together and bringing such discussions, and this will pay a long way in producing the health for our country in the ensuing months and ensuing years.
Glad to know, Dr. Jayalal, that this is something underlying thing that is on par with Indian administrative services, police services. We should also look up to Indian medical services for the overall development. This comes from Dr. J. Jayalal, National President for Indian Medical Association. I'm sure there are also certain IS officers who have done their medical degrees, their doctors themselves. And yes, this is to be noted for the overall holistic development. And it is the frontline warriors, healthcare professionals who could who have risen up to the occasion. Now, my next question would be to Dr. Khurana. We would like to know how has been the impact on the non-COVID cases, the elective surgeries, and because of this, how are you able to balance and strike a balance, and what are the challenges you face there, and what is the situation now?
This pandemic started way back in 2020 in March, when it entered India. So something which was not an emergency that time might have become an emergency. So we have all the protocols in place. We do the surveillance before admitting any patients. So even if there is a surgery, we have the best of the competitive laboratory staff. We do the CB net. 2 3 hours we have the report. So something which is urgent anyways can be done immediately. And similarly, something which is on elective side also, if we have follow the protective and the surveillance is happening, so I think there's no thing that we should delay any of the surgeries that have to be performed. So that's the information that I would like to give to all the people. The public should not wait that it's an elective surgery. Let me wait. It might become an emergency tomorrow. So just go for it. Just believe your doctor. Do the tests that are required, and once you're fine, I think surgery should not be waiting. So that's the message.
So now, thank you, Dr. Khurana, for your message, and I'm sure all of them out there who are watching us live now got the message. And now I would like to ask all of our speakers. So now it is believed that we have to live with these viral variants. So we would like to have initial remarks from Mr. Khurana. How do you see the new way of life and living with the corona variants or other viruses? Your take on that, sir.
Yeah, like this has been a normal thing now. Now it has become 2 years that we have been facing this pandemic. So people have been educated, doctors are aware. So more of counseling, more of psychological support, like the other speakers are speaking about. So more of psychological support, more of communication, more of literature review, more webinars like this so that people are aware what to do in this type of situation. So it's a normal thing. But as the most of the speakers spoke, let's not get lax with the what is happening that it might go down. So let's have all precautions happening. Mask should be taken care. We should not have overcrowding. We should have distance maintained, and let's hope that we work as a team and let's eradicate like we did the other things also. So I think we'll come out of it very soon.
Great, that's quite a good news for all of us. And now I would like to come to Dr. Kamineni, Gayatri Kamineni. How is it going to be living with these viruses, and how should we look up to our children and the young ones, or even the infant babies? Dr. Gayatri.
The virus is not going to go anywhere. Everybody knows that. And I'm pretty sure that other eminent speakers are going to agree with me. It's just going to change. So we need to make sure that we need to let go of our arrogance and our overconfidence that once we got, or second time we got the COVID, or we are affected by COVID, or the person has been contracted the virus. We need to be very clear that the virus is changing rapidly and you can be affected by it later too. So we really don't know how it's going to affect us in the future. But what we need to do, the biggest vaccine right now, it's not Covaxin, it's not Covishield, it's not Moderna, it's not Pfizer. The biggest vaccine for us right now is just wearing the mask. We have to let go of that overconfidence that, okay, fine, we are not going to get it because I already got it. So that is something that we need to take it forward day in and day out with us. More importantly, I think we've seen a huge decline in the number of non-COVID cases in hospitals in the healthcare sector during the first and the second wave. Third wave, because the information out there is actually saying that it's a very mild variant, a very mild variant. True, but at the same time, the OP, the patients coming in to have to come to meet the doctors to get themselves checked on an OP basis is still stable. But once we decide that we have to go ahead and get the surgery done for the patient or a procedure done for a patient, they immediately back out, and they've come to a point where, okay, fine, let this wave subside and then let's get into getting the procedure done. That is something that is against what the doctors are actually telling us as well, right? So a planned elective surgery is better than a complicated emergency one. So let us be very, very clear when we are talking about how we are going to move forward. So COVID is not going to die down. It's going to be there. It's going to live with us. And the second one is, let's trust our doctors. Let us listen to them. Let us um, go forward and go ahead by trusting them. Let us go and get treated. They are doing it for our good. They are not going to put us in harm's way. So that is something that we need to understand and go forward. Regarding children, um there are few studies which haven't been proved yet, but there are, just I'm just talking at the risk of scaring a few of them out there, but there have been studies where we can see that mothers who have been affected with COVID have actually given birth to premature babies. What is the status of the babies as of now? There are stable, there are studies still going on as to what consequences they have on children. But at the same time, these are still ongoing studies. So we really need to keep in mind that if in case that there's something going wrong with the kid, we need not attribute everything to COVID, but we need to make sure that proper care is being administered to them, proper care in form of continuing the vaccinations which are generally given to children. Hospital care is also advised for children at this point of time, given that proper precautions are maintained against COVID. So these are the things that we need to keep in mind. And yeah, I think going forward, we really need to trust our doctors. We really need to trust the healthcare system. And yeah, and then go forward with what the patients are suffering. They have to get treated for it and take their health into their own hands, get preventive health checks done continuously every 6 months, and then yeah, take control of their health.
Okay, thank you. Ma'am, this is really important because children who are born to mothers who suffered from COVID uh, really need to at least have this in mind that if there is anything going wrong, we should go back to our doctor. So that's very important for our viewers too. Our next question would be to Pranav. Pranav, what should be the way forward in terms of emergency care, and what are the gaps that you found at the ground level, which can be addressed now in the future?
Sure, thank you, Kaniza. Basically, I think everyone on the panel, right? We have such experts today, and there has been an insightful discussion. A lot of things have come out which have been, a great learning even for me in such a discussion. And as Dr. Jayalal and others pointed out, right, that the COVID pandemic, even though we can see the end of the tunnel right now, it's best to be optimistic yet cautious, I would say, today. And I believe that the pandemic has, forever changed the life of, a customer, an employee, a citizen, as well as a human today, right? Also, I would say that, the healthcare landscape in India has been continuously evolving. The pandemic did expose some vulnerabilities, but this didn't even happen in India. This happened across the world, actually. And I believe that a lot of positives also came out in terms of increased awareness of the people, increased focus on personal hygiene, preventive healthcare, right? And these things will help us, I would say, in the long run. Absolutely. Talking about the emergency response sector, I believe that there needs to be, more integrated healthcare facilities in terms of integrating the emergency response service with hospitals, healthcare institutions, labs, diagnostic services, and also if they can be linked to insurance providers and TPAs, right, so that we can also lead to faster admission processes in the future. These are some of the things that did come out. I would also say there can be increased focus on public-private partnerships, right, especially between state governments today, which would also help in improving the quality as well as the accessibility of emergency response services. We also have to look at because I believe that there is a lot of shortage of emergency medical technicians today in the country, right? We have about 1.7 nurses for about 1,000 people, much lower than the WHO standards. And in India, the number is actually three times more available in urban cities than rural cities. So the number is actually much, much lower. I also believe that there needs to be a data-driven approach in terms of not only planning strategic locations for ambulances, managing hotspots, but also looking at using these data-driven approaches for call center staffing, the people who are actually picking up calls, so that 100% of the calls are at least answered, right? And then we can look at managing those responses and triage accordingly. um, I believe that these are some of the things, and also we'll constantly have to look at an integration between availability of beds between the public and the private sector, which would allow us to be better prepared if another wave or another pandemic happens in the future. And I always say that it's very important to have a breakthrough innovation in healthcare because it always improves the accessibility and affordability of any service. But for a breakthrough to be truly great, it needs to be equitable, replicable, as well as sustainable in the long run to have that kind of an impact.
Absolutely. Absolutely. Thank you, Pranav. We should appreciate that youngsters like you have come up with initiative like Medulence. A round of applause for them. We have some questions from the audience, and based on the relevance, maybe I'll just put this question. One is there are many cases, even after becoming COVID corona negative, after few months there have been deaths that have been reported. Is this something to do the post COVID, the maintenance that needs to be done? Maybe Dr. Mishra or Dr. Khurana can answer this, or also Mr. Dr. Jayalal.
Yeah, indeed, definitely we are getting more cases of the COVID, post-COVID complication. In fact, we are getting around 20% of the people are coming with that. And death is also high, especially on the myocardial problem, the thromboembolic phenomena, and the problem with the central nervous system is very high. The COVID has impact on the thrombogenicity, increased thrombogenicity. So that is producing a lot of complications in the. So that is one reason why autoimmune disorders is also increasing. Previously, we thought it is the autoimmunity is happening within the during the time of infection only. But now we are seeing this happening even after the 6 months, after the long duration of the disease. Also, these things are happening. So that is why we are emphasizing that post-COVID is going to be a big challenge and big problem for us. So people has to be extremely cautious and do not take it very lightly. Whenever they have the problem of when they are prone for any coagulation defect, and when they are undergoing any surgery, when they are going the pregnancy, all these are thrombogenic events. So that time they need to be extremely cautious. If they are previously as a COVID positive, they should definitely tell that history to the concerned doctor whom they are getting treatment, and adequate measures of preventive measures the doctor will take, so that at least the death we can prevent to some extent. But post COVID is still a long way to go, and we are working on that. And uh, the maximum benefit the people will get by appropriately reaching out to the hospitals and taking care of the medical advices.
Doctor, there are many such questions. So, when do we expect, as you mentioned, that you all are working towards it? How, like, what are the precautions? Of course, the COVID-19 protocols are being followed, masking, distancing, and everything is there. So, what is that needs to be taken care, particularly other than going to surgeries and all, a normal COVID patient who has become negative, what is the care uh, should be taken in particular?
You are asking me?
Yes, Dr. Jailal, if you can answer that, or Dr. Khurana as well.
The only thing what we are now seeing, any disease, the one of the most important killing factor here is the stress. So when you are getting a disease, do not get stressed out, and your routine care of the nutrition, sleep, and the mental well-being that you need to maintain. Because what we are at this moment, the infection per se is going to cause less problem than the anxiety and the stress we are going to have is going to cause. So that is the one first thing you need to always remember. And if you are not having any comorbidity, the complications are also going to be very less. These complications are more common with the people who are having a comorbidity. So if you are a person who has already having a diabetes, having a hypertension, or having some other disorders of malignancy, then you need to be little more cautious, little more very strict on your diet control, your medication, so that you are maintaining appropriate your health with more and more care. Uh, that is only thing. But if you are a normal person, no comorbidity, and you have infection, please take it very positively. Work on to your continuous, the regular lifestyle, and you will not get into the problem.
Great. That's a good news that we need to be staying positive in this regard. Dr. Mishra, would you like to answer this? Like, what is this something to do with genome sequencing? Is it like we are all positive, all the tests show that we are fine, and but later on we also get to know about patients dying due to heart attack? Is there a long-term impact that we are still not knowing, or something like that?
See, this disease is only 2 year old. Before that, the virus was not known even, and we are learning. Many things we are learning, and long term effect that will come along with the time. Only time will tell. So, but having said that, the progress that has been made in the COVID research is just phenomenal. I mean, within a year having a vaccine is really just a short of a miracle. Nobody was knowing that it has never happened. This is going to change the history of medicine, that how vaccines should be made and how quickly they will be made available. And it has increased the confidence level of people in science and medicine. and regulatory authorities have become more confident to give approval to innovative methods of handling medical problems in a progressive and optimistic manner rather than being contrived and delaying and delaying. It's a common knowledge how many years it used to take for a vaccine and what has taken this time. In the beginning of the pandemic, you remember that we were running for queues in the for the testing. It would cost 3,000, 4,000, 5,000, that kind of money. Today, it can be done in a couple of hundred, and everything is indigenous. India is in position to export many of these items, which we were really begging. Even import was not. Five kit will come and go to five different cities and so on. So we have gone through that. So we have learned a lot from this. Now our position should be to let's come out of the stigma, let's come out of the fear, and let's dominate this virus. It's going to stay. So the how to do that. Now we know enough that we can do that by first following the COVID appropriate behavior, not letting the virus to have free run. Because if we do that, then we have better vaccines, we are going to have better antivirals, and we have all learned that health is important. And as you just heard Dr. Jailal saying that don't take unnecessary stress, avoid crowding, and many other things. So I think overall, if we look, of course, the people who are very senior citizens who have comorbidities, they are in a little bit of disadvantage. They have to take care of it. But I think in long term, although in coming 2 3 years, we have to keep fighting the effects of this COVID. But if we take the positives, we are going to really fine tune many ways that we have been dealing with life, both professional and also of day-to-day profession. I mean, we are having this discussion that was not thought of 2 years back. It is thanks to COVID that we can do this in sitting in our houses and be totally effective. So those are many gains that we have to look forward to, and I think there are ways and science have come up and provide many encouraging science, including using something as complex as genome sequencing for surveillance, is something amazing and which is now practically being done in many parts of the world, and India is doing it efficiently as well. And I hope these are the things that will continue and raise the standard of medical care of the people. And I'm sure, considering all these situation, and as Dr. Jalal mentioned, I think government should increase the financial allocations for this, because this is very important. If you don't have proper healthcare, your economy will suffer. Many things will affect. Children will suffer. So I think we have understood these things and its importance, and I'm sure everybody is aware of this. Those who are in the at the positions to take such policy decisions, and we look forward to better times in coming weeks and months.
Absolutely. Thank you, Dr. Mishra, for that inputs. Before we call upon our special guest speaker, there is one last question we'll take from the audience. Does the virus go milder and milder, and it will be free of such uh, deadly virus like corona? Is the question that has come. Would you like to answer this, Mr. Dr. Kurana?
Like most of the speakers said, no, let's not get laxated on the that the curve is going down now. There might be something else coming up. The mutations are totally different now. So something which had initially alpha, then delta. So let's not get lax, and let's continue with the precautions that we should have. Let's get to know to the doctor if we have some sign and symptoms. Let's not hide it from the family. People think that now it's mild, nobody is coming to know, it's not going to be harming me. So that brings in more stress. Like Dr. Jairam also said, let's not get into that stress level. Leave it to the doctor. Talk to the doctor. He's the best judge to talk about it. And just go and meet your doctor. That is more important. If you can't meet him from the house, you can give him a call, do a video call, talk to him. Just keep in touch with the doctor. So this is not going to, if something is going off from Omicron, we might have something else coming up tomorrow. So let's not get lax. Let's continue with the norms that are there, and more of surveillance is more important. That's my take on that.
Yeah, so that's a message from Dr. Gaurav Khanna, who's the CEO with the Glen Eagle Global Hospitals. Uh, Now, I would like to call upon our special guest who has been, who is a doctor, physician by education, and by practice, he is a national and international development professional, we can say. He is a 1985 batch IS officer. He did his medicine doctorate from Vellore, College, Christian Medical College, and he held many key positions. He was also the principal secretary for Department of Health, Family Welfare, Family, Women and Child Welfare in the erstwhile United Andhra Pradesh. Later on, he held key position um, in both the state government of Andhra Pradesh and also in the government of India. He is with over 35 years of experience in national and international organization. He also held key position providing strategic and operational leadership to ministries and departments including UNOPS, UNFPA, IFAD, Rural Electrification Corporation of India, and various others. So please, I had the opportunity to associate with him when he was the health department principal secretary in United Andhra Pradesh, and currently he is the visiting professor with Kautilya Public Policy. Which is a well-known institution, professor for public policy at Kautilya School of Public Health, and recently he was the former additional chief secretary to the chief minister, the government of Andhra Pradesh. So please join me in welcoming Dr. P.V. Ramesh. Thank you very much, sir, for joining us.
No, thank you. Good evening, everyone. Good evening to you. Thanks a lot for inviting me. Thanks to you, Sudhir, and your colleagues. Congratulations to all the participants and a really very insightful conversation. Thank you very much.
Sir, you as the earlier you were principal secretary and held a very key position, especially when you were as the functioning as additional chief secretary in Mr. Y.S. Jagan's office. You especially took care of COVID-19 spreading, and you took very innovative steps as well. We would like to have your concluding remarks, though we have taken inputs from all the esteemed speakers from across the country. We would like to have your take, and we are going to live with corona variants and various other viruses. So we would like to have your concluding remarks on that.
No, first and foremost, I mean, thank you for organizing this very timely conference and very distinguished panelists. I congratulate them. And actually, I am myself recuperating from my bout of COVID, notwithstanding two doses of vaccine followed by a booster. I've contracted the infection 13 days ago, so I'm still trying to recover. So I'm still enfeebled by this infection. I mean, so I'm not sure what variant it is, but I'm certainly had a short 5 day, but quite distressing experience. Now, in the last 2 years, of course, I mean, as the experts have said, we've learned a lot. I mean, I remember when we started hearing first in January 2020, we knew very little. I mean, we really didn't know what it was and how it was. And Andhra Pradesh at that time was one of the earliest states to start screening and conducting a surveillance and isolation. So we learned a lot since then, and vaccines and treatment protocols and all that. But what I would like to emphasize is this has been an unprecedented challenge to the entire humanity. In the last 100 years, I do not believe there has been an equivalent challenge. The world had witnessed two world wars, it had witnessed several upheavals, but there was never an instance where all 7.5 billion human beings are facing a common threat from a nano organism that has no command and control system, but each functioning autonomously and conducting itself in a way that it perpetuates itself and mutates and adopts itself to the new context and also to the new realities. So, this is one of the biggest challenges, perhaps, that humanity has faced, particularly in these days of globalized world and where travel movement from place to place has been so quick and so fast. So I think we now need to see ourselves in the midst of a continuing infection rather than wait for a wave to arrive. I think we really have traveled, and I think we are in the midst of an ocean or on the beach. But whichever way it is, I think the overall understanding that I have is that the country, the world, the professionals, the health system, and the governments need to see this as the new normal with which we need to live, which essentially includes, of course, the COVID appropriate protocol, and also the sense of discipline with which we conduct ourselves at a individual level and also at a societal level. But what I believe is much more important is the responsibility of first the governments in terms of vaccinating people and also ensuring that there is a periodic genomic sequencing that is done. There is a studies, there's a scientific evidence based monitoring. I mean, we've seen, at least what I have noticed is two three things. One thing is there have been inconsistencies in terms of the advisories that have come from the government as well as ICMR. I think they have been poor in leading the overall health system in this country in terms of guidance, not really evidence based. We have not seen as much of internationally published peer reviews literature as have even come from China in the very early days. In the early 2 months, in fact, much of the literature that I have benefited from had really come from China. In last 2 years, I'm not sure that we could be proud of the fact, notwithstanding the fact that we had thousands, hundreds of thousands, lakhs of people who had infected, suffered, gone through hospitalization, and continue to suffer post COVID symptoms. And I think we need to consider this very seriously. The third important issue is the data management. I think we've been quite wanting in data management. We have not really developed a data management system. I had been calling up in the last 2 years through my own way that there must be a uniform uh, national account system, particularly for a pandemic of this nature. We are in a situation in which we cannot compare today one state with another. We keep saying that Maharashtra or Karnataka or Tamil Nadu have high number of cases are being reported, but that's not the case. These states simply have set up a more robust reporting system, more transparent, more robust reporting system. We have not been also honest with the deaths. We should have learned a lot from the death audit, from the management audits, and our treatment protocols also have not been really conforming to the evidence based or the data substantiated protocol outcomes. So I think these are issues that the medical fraternity needs to reflect on seriously, and I think I'm glad to see that there are doyens of profession here, including the IMA, research practitioners, and I think it's a really a time that the medical profession really take a serious view of its own leadership of the public health issues. Fourth, importantly, I would like to say that this is time really that there is a real reconfiguration of the entire public health management system now, in which the disease surveillance becomes a lot more robust and as a matter of routine, not as a matter of when there is an epidemic or when there is a pandemic, but really as a matter of as that is institutionalized process right from the villages. And what is very important, and I'm not sure how much it has been noticed or noted, is the fact that the urban areas in India, barring few states, barring few cities, including the metropolitan cities, do not have a public health system. What we have is a hospital system. We may have very good hospitals, we may have very good health medical professionals, but what we are lacking is really the a robust public health response. So I think the urban areas, this is the time I don't see this happening, and I feel very concerned. And I hope that the medical fraternity uh, really wakes up and calls up the government, and particularly in the coming budget, that it is not that money just dumped in, because I know from my own experience of managing the health department in Telangana and Andhra states for 3 long years, and as finance secretary for 5 long years, where I was very intimately associated with the management of the health system, both the public and the private. And perhaps some of you who know me are aware of the fact that I also held additional charge as the vice chancellor of the Andhra Health University, and I was also director of the Nizam's Institute. So, in that sense, that I know I'm not speaking as a lay IAS officer, but as somebody who's informed about the complexities and the problems that exist. And so, I would like to believe really that the time this is the right time. I think if we do not address the challenges that exist, I mean, somebody mentioned about the human resources, the capacity of the system to manage, and these cannot be done by government alone. This needs to be done by the private sector as well. The private sector has to step forwards. We have also seen the extractive mindset in some of the hospitals, and at the height of COVID, I mean, the type of treatment and type of several people from the middle class who did not have a social safety net in the form of insurance or the government support had really suffered during this period, and they didn't really receive the type of the professional leadership that the private sector should have stepped forwards and said we place the lives ahead of our own profits, and that unfortunately did not happen. So this is the time really for a serious reflection, and I'm glad to see Dr. Mishra here. He had been really leading some of these research, the genomic sequencing, and he had also been talking about what really needs to be done in a pandemic of this nature. I've had an opportunity to interact with him when I was in Andhra Pradesh. So what I would like to believe is that I think we need to the research community as well. So I really believe that the doctors, the governments, the private sector, and the research institutions. This is the time to strengthen the research infrastructure in our country, really encourage the participation of professionals in more active collaboration with policies, with implementation, and in program planning. So this is really a matter that does not concern one hospital or one doctor or one profession. It is my belief that it confronts every single human being, and every single person who has the human DNA ought to come together and then address this challenge in a much more collaborative, much more comprehensive, and much more sustainable manner. Because this is, I mean, we all wish that this wave would be the last wave, but that is more a wish than maybe a reality. Maybe there would be many more variants coming in. Some may be less pathogenic, some may be more vicious. So we need to be prepared for this, and the way to prepare is not to wait for a wave to come. We are not surfing. We are professionals who are managing. So don't wait for a wave to come. This normal must encompass all aspects and build that resilience, the awareness. And media also, I would like to single out, has not been as responsive and as responsible, with notable exceptions, as it ought to be. We have had several unscientific propositions being made on televisions, and the political leaders as well. I consider this not just our country, but several countries across have not really been led by the professionals. I mean, somebody said the IAS, IPS officers did not know how to manage, and I agree with that. And obviously, they are not trained, obviously, they were not prepared, and obviously, they did not have the capabilities and the skill set to manage. But on the other hand, neither the politicians have been led by a data, by evidence, and by real belief in scientific establishment. And I have seen this consistently myself working with the chief minister, that there were no medical professional, let me repeat this, no medical professional who stepped forward to tell the chief minister what was the reality. So, I mean, this is a matter of deep concern, and I'm not referring only to government doctors, but I'm referring to every professional who had the opportunity to advise the political leaders, to tell them that this is the way that you must. Of course, I mean, you have people like Trump, and there are the people all over, but then the people need to have that education, and the professional needs to stand up and call out people. So, anyway, and to summarize, I want to once again thank you. I would like to believe that we are out of the woods, though I don't have the confidence that that is the case. So let us be prepared, and so constant vigil is the very small price that we need to pay for this terrible pandemic that has taken away millions of lives and have subjected a large proportion of the humanity, including our own countrymen, to a large suffering for a long time. And I particularly salute all the medical professionals, and I take this opportunity to pay my humble homage to those who have laid down their lives, particularly health professionals and other frontline workers in the battle against this pandemic. And thank you, and I wish you all the best.
Thank you very much, sir, for putting out that holistic scenario and the kind of approach we need to have going forward. So, as mentioned, let us be prepared, and also there is a need in the government system, public healthcare system, not just hospital systems, but also there is a need for government and public healthcare system to be strengthened further, and we should be well much prepared to deal with any such pandemic that would likely to occur. So, with this, as a token of appreciation, Dr. P. Sir, we would like to present speaker certificates to our esteemed panelists who have joined us from across the country. First, we would request you to present a speaker certificate to the National President of Indian Medical Association, Dr. J. A. Jayalal.
Congratulations.
Next, we would request you to present the speaker certificate to our very own Dr. Rakesh Mishra, Director for Tata, who has played a very key role in genome sequences surveillances. Director, Tata Institute for Genetics and Society, Bangalore. A round of applause to Dr. Rakesh Mishra.
Congratulations, sir.
Next, we would like to present the speaker certificate to Dr. Gaurav Khanna, who is the Chief Executive Officer, Glen Eagles Global Hospitals, Hyderabad. A round of applause to Dr. Gaurav Khanna. And also to Dr. Gayatri Kamineni, who is a Chief Operating Officer with the Kamineni Hospitals. A round of applause. Thanks for joining us, Dr. Gayatri.
Thank you. Thank you.
And also to our very own young dynamic Pranav Bajaj, who is the co-founder for Medulens.
Thank you.
Thank you.
First speaker, Dr. D. Nageshwar Reddy, who is the chairman for Asian Institute of Gastroenterology. This has been a wonderful, dynamic, I should say, a vibrant panel discussion. Many people joined us through various platforms, including YouTube and other social platforms, Facebook and others. We also put forward some questions that came from the audience. So this was the IndiGlobal Edge Factor that brings scientific and well-researched insight from healthcare leaders, policymakers, innovators, and experts empowering transformation. It is presented by IndiGlobal Media Network that takes innovation, collaboration, and growth to the forefront. So with this, we would like to thank all our esteemed speakers who joined us, and also the audience who have been very engaging and participative on various platforms. We would like to thank you all. Thank you so much.
Thank you.
Thank you. Thank you.
Thank you.
Dr. P.V. Ramesh, token of appreciation, sir, for you. Thank you all.
Thank you. Thank you.